So the topic of my presentation today is the silent killer. Assalamu alaikum everyone. The topic of my presentation today is about the silent killer of youth, smokeless tobacco use and oral cancer in Pakistan. In Pakistan, the use of smokeless tobacco, it is considered as normal. In Pakistan, smokeless tobacco, it is sold openly. It is sold near bus stops, local markets, and even near schools. It is easily available to everyone due to its accessibility and its cheap price. Talking about the prices, a gutka packet, it costs less than a biscuit. Among the youngsters, it is considered as something to show off. They use it to gain popularity among their friends and consider it as something cool. Mostly, they are unaware of the circumstances, but those who are aware of them try it for once, for fun, and then it becomes a habit to them. In Pakistan, although a lot of people, they use smokeless tobacco and they're victims of smokeless tobacco, for example, gutka, pan or chali, etc. Mostly at the age of 13, they were offered gutka by a friend, and then at 21 age, they were having difficulty in opening their mouth, and then at the age of 32, they were finally diagnosed with oral cancer. Although they never smoked, they never drank alcohol or any other substance, they only chewed, and that was enough to them for causing oral cancer. Pakistan has one of the highest oral cancer burdens in the world, and unlike many countries, this crisis is considered largely driven by smokeless tobacco use. Products such as gutka, pan with tobacco, niswar, and chali are cheap, widely available, and socially accepted, leading to early and prolonged exposure. The carcinogenic chemicals in these products cause precancerous lesions that frequently progress to oral cancer, making this disease largely preventable yet alarmingly common in Pakistan. Here are a few common sources of smokeless tobacco. Example number 1, chewing pan with tobacco, then misri, gutka, dry tobaccos, and also sucking on dried tobacco with chewing. Smokeless tobacco rapidly leads to addiction due to the presence of nicotine, a highly addictive substance that is efficiently absorbed through the oral mucosa during chewing. Repeated exposure stimulates dopamine release in the brain, creating dependence and reinforcing habitual use. Areca nut, another key component, has psychoactive properties that further enhance stimulation and compulsion, while slacked lime increases the alkalinity of the saliva, allowing nicotine to be absorbed more quickly and in higher concentrations. Together, these substances, they create a powerful addictive cycle, causing users to chew more frequently and for longer duration, often beginning at a young age. This sustained repeated exposure not only deepens addiction but also significantly increases the risk of chronic oral damage and malignant transformation. The use of smokeless tobacco, it is increasing day by day due to various factors that include low awareness rate and youngs that are exposed, and due to the easy availability and the weak enforcement of law. Talking about the role of dentists in the early diagnosis of oral cancers, they play a crucial role in the early diagnosis of smokeless tobacco-related oral diseases by performing routine oral examinations. They can identify precancerous lesions such as leukoplakia, erythroplakia, and oral submucous fibrosis before symptoms appear. Through patient interviews and history taking, dentists can detect habitual smokeless tobacco use and provide targeted counseling to prevent progression. But early detection not only increases treatment success but also allows timely intervention, significantly reducing the risk of malignant transformation and saving lives. There are a few factors that can account to prevent the use of smokeless tobacco that could reduce oral cancer in Pakistan. That includes policy and regulation, education and awareness, screening and early intervention by visiting the dentist on early or regular basis, and community engagement as well. The silent epidemic of smokeless tobacco, it is not unstoppable. One choice can save a life, and one life could change a million lives.